This is very common and unfortunately in all countries. Breast implant issues. Here's a normal breast implant before implantation. Here's one with explantation on the right after it was removed. What do you think all those things are?
Wow, so we actually see that implant that has all these black spots all over, and that's mold?
That's because in a study, this is published in this study of 2022, 200 women with breast implants, positive cultures were found in 68.5 toxic molds.
Oh my God, so almost 70% of those women who had breast reconstruction with like it was a silicone type of breast implant?
Whether it's saline or silicone doesn't matter.
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Our topic today is mold and health. We will discuss how an indoor moldy environment and mycotoxins, which are produced by mold spores, may affect the human body and multiple organ systems, from neurological to gastrointestinal, respiratory, immune, and many others. More recently, there have been a growing number of media articles and lawsuits related to severe illness resulting from indoor mold exposure or mycotoxicosis. To date, several hundred mycotoxins have been identified. The main challenge is that this problem, particularly chronic exposure to mold, often remains unrecognized by medical professionals, except when large numbers of people are affected. The harmful effects of molds and fungi have been known since ancient times, and also in the Middle Ages. For example, thousands of people in Europe died due to ergot alkaloids from a fungus which contaminated wheat and was used to bake bread or eat contaminated apples, for example, causing hallucinations and severe neuropathy with intense burning of the skin, a condition known as sacred fire or St. Anthony's fire. General interest in mycotoxin research increased in 1960s when animal farms in England were affected by aflatoxin, a type of mycotoxin found to cause liver cancer in both animals and humans. Toxic molds can affect multiple organ systems and present with a wide array of symptoms, making diagnosis challenging. This is why our guest refers to it as the Great Masquerader, posing significant difficulty for clinicians to recognize and treat in timely manner. Most doctors do not have the training to identify mold-related illness. I like this quote by one physician who said, "Possibly every doctor in the United States is treating mold illness, and they just don't realize it." This is why we have invited an expert in the field of clinical immunology, toxicology, and holistic and environmental health, Dr. Andrew Campbell, who has been recognized as one of the top 100 health professionals in this field. Thank you so much for joining us, Dr. Campbell.
Thank you so much. It's an honor being here with you on this podcast, Dr. Irina.
Yeah. When I met you, I truly appreciated your passion for helping patients. You have studied, and you have successfully treated actually 17,000 patients, which I found out from your biography, which is absolutely remarkable. I also admire your love for science, which I recognized at the conference many years ago when you and I met. And in fact, you have published over 100 scientific studies in peer-reviewed medical journals and medical textbook chapters. You're also editor-in-chief of several medical journals, including Microbiology Research and Alternative Therapies in Health and Medicine, and you serve on the board of many others. For the past 30 years, you have been frequently invited to present at national and international medical conferences, which actually how we met, including at Oxford University in England and Harvard Medical School. You also have been interviewed by ABC, CBS, and NBC, and featured on several TV shows, including 2020 and the 24-Hour Investigative News and many others. So I'm really honored for you to be here. I really appreciate your knowledge and your really kind heart, because that's kind of how I witness you approach your patients, Dr. Campbell.
Thank you so much. Thank you very much, Dr. Irina. I appreciate your kindness.
So, let's try to unpack this mysterious mold and toxic mold illness. So, can you please tell our listeners what can toxic molds cause and how do they do that?
That's a very good question. There's a lot of misinformation on this in the internet and also in social media. And I base everything on medical evidence and scientific evidence. I was taught in medical school, and God we trust, everyone else has to show data. So that's what I say. When they say, oh, use this or that, I say, wonderful, show me the data. And if they don't have it, then it's just an opinion. So what can they affect? In the first place, mold spores, which carry the mycotoxins, are 2 to 4 microns, which is a hair is 100 microns. So these are very small. They go into the deepest parts of your sinuses, into your lungs, and they go then from there into the bloodstream. The first place they go is the brain. So what does that result in? Brain fog, fatigue, sleep disturbance, anxiety, depression, all kinds of brain-related and short-term memory loss, all these brain-related things. From there, it creates inflammation in the organs. One organ, of course, is, aside from the brain, lungs, kidneys, liver, the medulla of the bone marrow, and the gut gets affected, and the skin can get affected as well. And of course, it also produces problems in hormones. For example, a lot of Hashimoto's thyroiditis is caused because of the reaction with hormones with mycotoxins. Also, there's mycotoxins can cross the placental barrier. And since mycotoxins are teratogenic, meaning they can affect adversely the fetus, that's a problem too. And mycotoxins come out in mother's milk. So you see, it's a problem that's really, really pretty overwhelming in the human body. And again, it's a toxin, so it's a molecule. It's not a living thing. And toxins, none of them are good for us. Mercury is a toxin. Arsenic is a toxin. Mycotoxins are toxins. So that's how they can go and affect everything. A lot of people complain of muscle and joint aches and pains. The number one symptom usually is fatigue, and they go to all the organs.
Yeah, and that is probably where the challenge is, right? So as a toxin, so it affects so many different parts of our body. So is that's why it is so not recognized by many healthcare providers?
Yeah, I mean, there's people that get misdiagnosed because, as you said, it's the World Health Organization calls it the Great Masquerader. And so they get misdiagnosed as fibromyalgia, chronic fatigue syndrome, again, Hashimoto's thyroiditis, but they're very difficult to treat. They get misdiagnosed, things like POTS and autoimmune disorders. whether it's rheumatoid arthritis, lupus, MS. There's a study that was published by Rutgers University School of Medicine in New Jersey showing that a large number of MS patients, actually the MS is caused by mycotoxins. And if you treat the mycotoxins, guess what happens to the MS? It goes away.
Oh, so with the actual reversal of the symptoms of MS?
I've treated many people. They come, these are young people. Of course, at my age, if you can see from the color of my hair, I'm not young anymore, but at my age, everybody is young. But these young people are in their 20s and 30s. Some come in wheelchairs. A year later, they're playing tennis.
That is so interesting.
Why?
You said that. Yeah.
How does you treat toxins? First, you identify the cause. Second, you remove the cause. Third, you repair the damage. And the patient is well again. And so you cure instead of treat.
So what is the actual mechanism of action of the mycotoxin in terms of the brain, for example, right? So like the case of MS, as you mentioned.
So these are molecules, and as molecules, they work at the molecular level, not at the cellular level. So they go into the cells and they destroy the they cause mitochondrial dysregulation, and that means the cell dies. So in the brain, we have astrocytes, we have oligodendrocytes, neural cells, etc. And our myelin comes from oligodendrocytes in the brain. Well, you destroy those cells, you destroy the cell source of the myelin. And this was shown in a study published in 2004, 20 years ago. So, and it's actually a chapter in a medical textbook. So it's not new.
So just for our listeners, obviously, myelin is the natural cover of the nerve sheath, so that helps with the propagation of the neuronal stimuli, so how the nerves really work in a normal body. But when that particular myelin sheath is affected, so then there is a delay in the normal speed of the nerve stimulus, right? So, and that's what MS is all about. So, is the damage to that myelin sheath. So, and you're saying that there was actual study published that some people with MS were actually tested for the mycotoxin.
Well, not only that, but in studies done on Alzheimer's disease, Parkinson's, amyotrophic lateral sclerosis, also known as Lou Gehrig's disease, even at autopsies on patients with Alzheimer's disease, they found every single part of the brain had fungi, even the cerebrospinal fluid. At another medical center in another country, they did the same on patients with amyotrophic lateral sclerosis, and they found the same thing, fungi in all parts of the brain, including the cerebrospinal fluid. And on Parkinson's, there's 3 mycotoxins that can trigger and then worsen Parkinson's. And again, you take out this, and then there's no problem. I've treated many patients with the spouse came and said, my spouse has Alzheimer's. Here's all these neurologists that they've done MRIs, they've done everything. And then they check their home, and there's mold on here and there. They get it remediated. You treat the patient 6-8 months. They don't have Alzheimer's. They're driving around and they're fine. Whereas before they couldn't leave the house because they'd get lost. Wow. And this has all been written about. So it's published studies. It's not my opinion. And it's not my story. It's medical science and medical evidence.
That is really interesting. And why is it not like a routinely tested for those patients, do you think?
Well, again, I think that the issue is that a lot of doctors don't recognize this. And then there's other groups that follow a particular method that's unproven in science and medicine. And I get about 50 emails a day and saying, I went to a functional doctor and he did the Shoemaker Nathan method for me, and I'm 3 years on and I've spent all this money and I'm still sick. Can you help me? And then there's those patients that I've spent all my money on these treatments and tests and I'm still sick because they're not inexpensive.
Right.
But you can get well in 6 months.
Wow, and we'll get, of course, to the therapeutic part of it and the treatment. But I'm still kind of trying to understand are there any different specific mycotoxins that affect brain and others affect, let's say, GI lining or respiratory? Are they specific, or they kind of more of a how do they work, I guess, those toxins?
Yes. There are some mycotoxins that, for instance, the one I mentioned about multiple sclerosis, it's called gliotoxin. The one I mentioned about the babies and transplacental in the pregnant woman and then in the breast, that's ochratoxin. The one that is known to cause autoimmune disorders, a lot of autoimmune diseases, are basically deoxynivalenol, gliotoxin, and ochratoxin. So different, but they're all bad. And if you have one, you're going to have another one somewhere in your body. They don't come alone, because one toxic mold can make several mycotoxins. And one mycotoxin can come from several different kinds of molds.
That's why it is so confusing. And of course, not every single mold produces toxic mold, right? So
there's over 1 million species of molds. They affect plants, trees, leaves, insects, animals, ocean-going things in the water, various plants, etc., different oceans, and even certain fish, etc., crustaceans, but those don't affect humans. There's only a couple of dozen that affect humans, and that's when they grow indoors. What grows indoors is important. For instance, if you live in let's say a 2,000 square foot home, and you have some mold there, let's say you have the same mold outside, how many square feet is outside? It gets diluted. It's like pouring a cup of water in a lake and thinking it's going to rise. No. So indoors, because it's constant. Where do we spend 95% of our time? Indoors.
correct.
So this is where we inhale all those spores that carry the mycotoxins.
So and once you eliminate the spores, only then you can stop the propagation of this, disease, basically.
The first step in any treatment for mycotoxins, molds, toxic molds, etc., is the first rule of toxicology. Get the patient away from the toxin, or the toxin away from the patient.
But is that enough when let's say, a patient removes him or herself from the toxic environment? Does this mean that he or she will actually have improvement in the symptoms, or still needs a treatment?
So there's still 3 other steps. That's the first one and the most essential, because otherwise nothing will help you. Say you worked in a lab and they made mercury. You keep going back to the same lab, you're going to get exposed to mercury every day. you're still going to get sick and you're going to get sicker. So that's the first step. The second step is you have to take an antifungal medication, such as itraconazole, because that kills the spore from the mold that's carrying the mycotoxin. You kill the spore, you don't have a source of mycotoxin. Now, there's two types of antifungal medication because there's two types of molds. Single cell molds, like you mentioned, it's like baker's yeast, brewer's yeast, yeast as in candida and all those. Those are single cell molds. And that's treated by a medication called fluconazole, or is generic name. Now, all the other molds, penicillium, aspergillus, stachybotrys, etc., those are multicell. So fluconazole, or otherwise known as diflucan, will not touch these. Itraconazole will, but itraconazole kills both single and multiple cell. So it's better to take something that kills all of them, doesn't matter. And then you have to have a anti-inflammatory, low histamine nutritional diet. You can't have Pringles and Coke in front of the TV every night. And then the last one, and just as important, this is a four-legged table, is there's 8 specific supplements and vitamins that have been shown in studies to help in the rebuilding of the immune system and of the cells in the body that mycotoxins have affected. And they're at specific doses. So it's not like, and there's only 8 because, for instance, today I spoke to a mother. She was on 30 supplements. Well, what happens? There was a study published in November 2023, a year and 2 months ago, where they took 60 of the most popular supplements that people bought to a laboratory. And they wanted to see if what's on the label is in the bottle. And what they found was 11% of all those 60 had in the bottle what it said on the label. 40% had nothing in the bottle that it said on the label. So here's these people taking 20, 30 supplements. What are they really taking? Nobody knows.
Yeah.
So this is why it's these 8 specific supplements and vitamins from very specific sources at very specific doses that studies have shown help people with problems with toxic mold and mycotoxins.
Yeah, and would be great to actually go over some of those, as you mentioned. But I also wanted to understand a little bit more. How does this autoimmune response to the mold and to the mycotoxin affects our body? I mean, again, like if you could describe, because there are so many people these days with the autoimmunity, right? So, an autoimmune related disorders, but you're saying that there is at least some part of that category is related to the mold and mycotoxin.
Yeah. What happens is that, again, they're molecules, so they go down to the smallest part of the inside of the body, and then they destroy cells by destroying the mitochondria. So that also means certain blood cells, certain liver cells, certain kidney cells. They're known carcinogens. Mycotoxins are known carcinogens.
Oh, goes in
And believe it or not, now they did a study on 17,400 cancer patients with 35 different types of cancers from all over the United States, multi-center study. 17,400, 35 different cancers, they had tissue and serum, and they all had mold. So then they started treating them with itraconazole, which I mentioned is the antifungal. And guess what happened to the cancers? Some of them shrank, others stopped growing, and others went away completely. And so people don't say, well, that's your opinion. No, this is a published study, and I have photographs of people's cancer before and after treatment with just itraconazole.
Wow.
I can show them to you whenever you want.
Yes, please. Could you show us?
Sure.
So that means that mold and mycotoxin has immunosuppressive type of effect on our body, right? So does it suppress? I've read that it suppresses thymus, which is the main, of course, organ in our body that produces the immune cells defensive
So here's the study. It was published
billions.
in 2022 in September in the journal Cell. And here's what they said, but here's the photograph. The left two photographs, you can see this is a man's forehead. You can see the cancer. It's pretty visible and big. And day 59, 2 months later, you can see the difference.
Yeah, almost complete healing in the last day 59. Wow.
So,
And that's the carcinoma, skin cancer. That's impressive photo, I have to say.
anyway, I think you're on the right track when you said it's the great Masquerader.
Yeah, and it's really interesting. You mentioned mitochondria, right? So because now, of course, it's a buzzword, so everywhere from anti-aging to obviously many other, chronic disorders, heart diseases, etc. So everything leads to mitochondria.
Right.
So, and you're saying that mycotoxins basically disrupt the mitochondria. So, and that's obviously
And then there's
the beginning of the end.
what about, for example, SIBO?
Yeah, God.
And people get SIBO, women get it, their abdomen looks like they're 6 months pregnant, and it's treated and again and again and again. What happens if it's not what that is? It's the masquerader, mycotoxins causing this. I can show you a picture for that too if you'd like.
Yes, please.
Okay. And this is a young woman. She felt terrible, and she let me sorry, here we go. You can see pre-itraconazole treatment, June 10, 2021.
So yeah, basically somebody who has severe bloating, so with a lot of distension in the abdomen. So and she was
December 12th, 3 months.
She was diagnosed with this SIBO, small bacterial overgrowth, right? So that's what how we're looking at for people who are just listening. So we're looking at that first picture. Mm-hmm.
And this is what mast cell looks like, mast cell activation from mycotoxins. This is the young woman.
Just 1 second, Andrew. Going back, so and then you're saying that with that lady with SIBO, so because the picture from June to September, so basically in 3 months or so she had complete flattening of her abdomen, so and she doesn't have any distension and her symptoms went away.
Right. So mycotoxins in many studies and publications have shown they cause ulcerative colitis, Crohn's disease, inflammatory bowel disease, irritable bowel syndrome, and you just saw SIBO.
And for that, Andrew, does a person have to ingest it, or it can still be through the respiratory route, like through inhalation? So how do?
Well, this is all in derma. I mean, it's a molecule, so it goes on the skin and it gets absorbed.
Okay. Okay.
And then you also inhale it.
So it ends up in your blood, basically.
Exactly.
Oh, that's interesting. So it doesn't almost matter if it is ingested or inhaled or
Correct.
topical, because of the size of this mycotoxin is so small that can penetrate and still end up in the blood. And that's
Right.
how it spreads all over the body and causes all these systemic illnesses. Okay. And you had another picture with the skin. Can we see it again?
Sure.
Skin problem. So
Let
this
me-
is a pretty dramatic looking rash.
This is what is called mast cell activation, and it comes from mycotoxins as well. It affects the skin, and it makes people have these itchy blotches everywhere. This is a before, and here's the before and an after, and she's showing her wrist. This is her wrist before and now. And here's another patient before
Complete resolution.
and then
Before and after, and complete resolution of the massive rash all over the trunk and the limbs. Wow.
And here's psoriasis. This is actually the mother of a doctor that when you and I were both at A4M, he was also lecturing there. And this is after treatment. She took this with her phone. So this was before, and on the right side after treatment.
So
Here's
just with the
skin.
antifungal treatment, so you're saying that the psoriasis, she was diagnosed with psoriasis, and she obviously looks like her skin looks like psoriatic plaques and lesions. So, and now we're looking at up to 6 months completely clean skin in her legs. So, so that means that even psoriasis potentially can have, as an origin of psoriasis and etiology, could be mycotoxin.
Yeah.
Wow.
So this is another example of psoriasis. And if you look at the ring finger here, this is rheumatoid arthritis and psoriasis. So
And psoriatic arthritis.
and you can see the abdomen and chest, and again the finger. And this is after
swollen red joint with a lot of skin. And at 6 months.
Yeah.
Oh wow, significant improvement in all skin.
And this is a gentleman who for 10 years went to have steroid creams, steroids orally, and all that. All these patients had been treated for a long time with all kinds of things without any success.
And do you believe that all psoriasis actually can respond to that, or only some subtypes? How exactly?
If 17,400 cancer patients with 35 different types of cancer respond to the treatment, then the conclusion, of course, is that yes, there are people who may develop an autoimmune disorder because of genetics. But actually, that amount is maybe 20%. What about the other 80? And Dr. Vrzdani and I and other doctors have published studies showing how environmental factors trigger autoimmune disorders.
Meaning, like, even when you reduce or eliminate those environmental or mold factors, so the autoimmunity still could persist and cause, of course, rheumatoid reaction. So, but some could be resolved because the autoimmune response quiets down and people have complete resolution of symptoms.
Yeah.
That's quite remarkable.
Yeah. And of
Well,
course, for instance, it can be other things. And I'll just show you one slide on that if you'd let me.
Yes, please.
This is very common and unfortunately in all countries. Breast implant issues. Here's a normal breast implant before implantation. Here's one with explantation on the right after it was removed. What do you think all those things are?
Wow, so we actually see that implant that has all these black spots all over, and that's mold?
That's because in a study, this is published in this study of 2022, 200 women with breast implants, positive cultures were found in 68.5 toxic molds.
Oh my God, so almost 70% of those women who had breast reconstruction with like was it a silicone type of breast implant?
Whether it's saline or silicone doesn't matter.
Oh, that's interesting because, of course, a lot of people are now aware and remove specifically their implants because they become sick for years.
Correct.
And women, but it's not necessarily the silicone itself or the saline itself in those pouches, but it's actually as a secondary reaction of those products being basically contaminated by mold and the mold causing all of that. Is that what you say?
Well, interestingly, breast implants came into use in 1960s. The FDA was not made until later. So they were grandfathered in without having to show they were safe.
Oh, I didn't know that.
And so then a lot of women were having problems, etc. Dr. Rajdani and Dr. Brapauer and I published in the early 1990s, 30 years ago, 32 studies on breast implants, how to test for, how you know, etc. And then I was called in front of the NIH to testify, not testify, but demonstrate the studies that we had written. And then 6 months later, they shut down the manufacturers and said, no, now you have to do like any other, you have to show they're safe. And they're still not safe. And if you ask a lot of people, oh, they're fine, there's no problem. But it's called breast implant illness.
Wow, that is quite interesting. So people need to know that. Right? Yeah, so talking about women's health, so you mentioned that mold can cause some hormonal problems, including thyroid disorders. So thyroidism or
Oh, yeah.
or all sorts of different subtypes of thyroid problems.
Well, for instance, one mycotoxin known as zearalenone is a highly estrogenic one. What does that do for men? It lowers their testosterone very low, even if they're in their teens. What does it do to young girls? They develop menarche starting at age 6. They start having menstruations, precocious puberty.
Wow. Or probably polycystic ovarian diseases and other.
What about an adult woman of childbearing age, a woman of 20, 30, 40? Totally changes the estrogen-progesterone balance.
What was again the name of that mycotoxin that
It's called
increases?
zearalenone.
So that increases the abnormal, basically, production of the estrogen. Wow, that is.
The test is always by blood.
Yeah, that was my next question. So how do people really test, and what is the most accurate way of testing? Is it urine? Is it saliva? Is it blood, serum?
Let me again turn to published studies and share with you this. This is from a study published by these two doctors. Several popular organic acid tests claim to detect imbalances in gut bacteria and fungi, but they don't really measure. They're not validated studies. And then, of course, here's Dr. Verdani's slide showing look for the body burden of chemicals or mycotoxins not in urine. Don't measure what's coming out in the urine. Well, where did he get this from? First of all, urine is in many foods. For one, milk, pasteurized milk, the kind you buy at the supermarket, 90% has 1 to 4 mycotoxins, but it's in parts per billion. Well, your body gets rid of that right away. And as it says, it gets rid of it in the urine. So let's go to a study that was published in October 2022, comparing urine to blood. And they said that because the variability of mycotoxin concentrations in urine and its volume based on daily intake, means how much did you drink or what did you eat that day, demands urine sampling at different times during the day. Okay? And because there's so much difference between people, because some are men, some are women, some are older, some are younger, diet, what they ate, they drank, muscle mass, all of these influence creatinine secretion, which is how the test on urine is done. Well, they also looked at what is the most exact test. So the ELISA method to detect mycotoxins in human serum comes from with significant accuracy, precision, and specificity. And there's one lab in the United States that does this, and it's MyMycolab. It gives you 14 different mycotoxins, both for toxic reaction and 14 for mast cell activation. And again,
and the MyMycolab, and we will post it on our
correct.
podcast website, of course, the link to that. So you feel they actually use mostly the serum, correct? So because obviously, as you mentioned, urine is a very cumbersome. So to do 24-hour collection at different times, and and it depends on the body mass and composition. So versus the serum is the most accurate.
Yeah. So you as a doctor and I as a doctor, we know that patients come to us and expect us to know what is the best for them. Okay, that's our duty. That's our profession and our obligation. So people don't look up things. They just assume. They don't study things. Well, here's a study. And then we talked previously about the study about all the supplements.
Right, which is quite frightening, I have to say. So yeah, that's interesting. So, and the lab measures, you said 14 different mycotoxins.
Well, let me just mention this thing. As we mentioned, they can affect hormones, just like we talked about zearalenone, and how one can cause a lot of problems with MS. And then we went to Alzheimer's, Parkinson's, and amyotrophic lateral sclerosis. What about autism? What happens in the brain in children? So a study at Rutgers University in Boston, Massachusetts, not Rutgers, they did a study on 172 children with autism. And they had 60 controls, 60 children who are normal. And they did serum this test on all of them. All the ones with autism, 92% was positive for mycotoxins. 0 in the normal children.
That is really remarkable, I have to say. And it sounds like it's so easy to test and obviously treat. You mentioned only one antifungal, itraconazole or Sporanog's brand name, so that can potentially help the patients. How long do people need to take it to really have some?
It usually takes
curative
6 months to get well.
6 months. And do you need to retest afterwards to see if the
So you test in the beginning,
Mhm.
you do the treatment for 6 months, and and then you test again at 6 months.
And you feel like typically people have some change even within 6 months in their laboratory testing.
Well, the mycotoxins urine has come from what you ate. So if you had a peanut butter sandwich, or you drank some milk, or you had a yogurt, or whatever, you're going to have some mycotoxins, but it's going to come out in your urine. Doesn't mean you're sick. Actually, it's a good thing. It means the body's getting rid of it.
Mhm.
But it doesn't tell you if you have it in the body. You're measuring what's left the body, not what is in the body.
Right. And that takes me to my other question, actually, in terms of the protective mechanisms. I believe during one of the lectures you mentioned that our GI or the inner lining of the gut has some protective mechanisms that work to eliminate some toxins.
Correct.
And that's why you're not really keen on to using too many binders.
Well, there was, on that particular issue, a published study by a doctor, a gastrointestinal doctor, professor at Washington University in St. Louis, and I published a study. It's called Molds, Mycotoxins, the Brain, the Gut, and Misconceptions. We showed all the different layers and protection that is in the gut to detoxify the gut, because we're exposed to toxins every day. We eat every day. We drink every day. We put things in our mouth that we don't think of. The end of my glasses. Sometimes you go like this. Well, there's all kinds of things that come into your body. We eat, we do things. Think of what we wash our bodies with, and what we wash our clothes that we put next to our bodies with. Those are chemical phosphates. So all these things make a difference.
So and you were saying that the gut does have some intrinsic mechanisms, protective mechanisms, to including our microbiome that works to eliminate all those mycotoxins. But
Right.
yeah, okay. So, but not necessarily all of them, especially not the most harmful ones that are already in our bloodstream.
Correct.
Said, and that is so hard to eliminate. And some of those binders, obviously, that people have been using, so the activated charcoal, zeolites, bentonite, all of those going to help to eliminate, because it's all oral intake and absorption of the toxins from the inside of the gut lining, but the toxin is already in the blood. That's kind of what you said.
Correct. So if I can show you one more screen,
Yes, please.
and this is on binders. So this is a published study, effects on human health. So we want to know what it does in humans. I'm not interested in rats, rabbits, sheep, piglets, chickens. Binders rely on the absorption of mycotoxins from the gut, preventing it from getting into the bloodstream in animal studies, including archaelinite, clays, activated charcoal, zeolite, bentonite, etc. They're effective in neutralizing aflatoxin. Well, aflatoxin is not an indoor mold. It grows on certain plants. Binders are ineffective in all other mycotoxins. And in addition, they also bind vital vitamins as well as macro and micro elements. Well, what does these macro and micro elements mean? It means things like zinc, magnesium, etc. Well, then I've talked to doctors that say, yeah, but I tell them to take the binder 3 hours or 4 hours apart. I'm so sorry. That doesn't work. The studies show what works and what doesn't. Maybe that's your opinion, and you have a right to your opinion, but everybody's got an opinion. We want to know, what is the data? What do studies show? Know what your opinion is.
That is really interesting. So, and then again, one of the most effective treatments, as you already mentioned, of course, is antifungal medication called Sporanox as a brand name, or itraconazole. So, how safe is this drug? Because I understand people have to take it for 6 months, which obviously is a long period of time to be on the antifungal medicine. And are there any side effects? Anybody? I mean, do people need to be aware of any particular side effects like liver toxicity or?
Well, if you go to social media and in certain websites, they'll say that, if you take itraconazole, your eyeballs are going to fall out, your hair is going to fall out, your liver is going to fry up to death. I would like them to show me the studies that say that, because all the studies show that itraconazole has been used for 42 years with minimal side effects and a safety feature that shows that you can even take it up to 400 milligrams a day without any problems. So if they can show me a study that study is wrong, let them come and show me.
I see. Well, that's I guess that's good news, right? So, and then what, if you don't mind, Dr. Campbell sharing? So, what are the additional? You mentioned 8 specific nutraceutical supplements that you typically recommend. I understand as an adjunct treatment to Sporanox.
Sure. Now, don't forget that all generic medications come from India or China. So in my patients that I've treated, and I've treated almost now 18,000, about 5% will sometimes say, I don't feel good, I feel queasy, it bothers my stomach, etc. In that small 5%, I switch them to Sporanox, name brand, and everything goes away. But in the other 95, they're fine. And this is children, young people, adults, geriatrics, doesn't matter. Because just like we see everything.
Oh, that's good to know. Yeah. So, yeah. And what are those 8 specific nutraceutical supplements that, again, you suggest, and why?
For example, let's take phosphatidylserine. Phosphatidylserine, they did studies, double-blind, placebo-controlled, randomized studies, which are the gold standard in medicine, on phosphatidylserine, showing how it helps remyelinate the brain.
Oh, okay.
Well, this is good for people.
Right. Especially MS patients, they absolutely need it.
Another one that is misunderstood by many people, and that's the very simple melatonin. At 3 milligrams, not 50, not 20, 3. Why? Studies at the University of Texas, San Antonio Branch School of Medicine showed that melatonin helps remove toxins from the brain.
Oh, interesting.
So why not take melatonin?
Oh, that's quite interesting.
So in many cases, we are either deficient in these vitamins and supplements, or we are insufficient. I'll give another example. Dr. Linus Pauling, who won the Nobel Prize of Medicine twice, and who developed the whole thing on vitamin C. He says take high doses, not 250 or 500. That doesn't do anything. Secondly, you need to take magnesium. If you don't have magnesium, you can't absorb vitamin C. And vitamin C is a vitamin we need, but we can't make and we can't store it.
That's right.
So we have to get it every day. But if you don't have enough magnesium, nothing happens. Another deficiency is magnesium. What did our great-great-great-grandparents do till back to Adam and Eve? Where did they get their water from? They got it from pulling water out of the earth, water wells. Okay? Well, the earth is full of minerals. And that's where they got their magnesium and zinc and all these other minerals. But now we drink out of bottles and we drink purified water where everything has been removed. That's good. So the point being is that you need that extra magnesium, but there's 6 kinds of magnesium. And if anyone's interested, I published a study on magnesium. Most magnesium that people take rises in the blood in 2 hours and then is excreted in the next 2 hours. So it only is there for 4 hours. You have to take other kinds of magnesium that are long-acting. So, and all this comes from published studies. So I've explained a few of them, but it's like that for everyone.
Yeah, that is quite an interesting protocol. And I know that you share a lot of lectures and videos on your website and a lot of specific protocols and a lot of detailed description of all those nutraceutical supplements and the dosages and etc. So that can be readily available for people, obviously, to supplement during their treatment. But of course, Sporanox is by prescription and it has to be prescribed by their doctors, clearly. So, but the supplements can be taken based on your even consultation. I know you do consultations to so many people and you're very generous with your time to so many patients and do it online, which is very easy. So you actually helped me a couple of years ago. So I have to say that thanks to your protocol, so I was able to not only work but walk, because I did have some long COVID related problem, and then of course they diagnosed me with multiple other things, including mold. So yeah, I got to thank you. So that's how I first-hand experience with your protocols, and it was very effective. So also, of course, you know, my I remember my first surprise with the mold and your amazing lecture that you delivered at the Anti-Aging World Forum in Las Vegas. So when we met a few years ago, so when you did mention that some disorders like MS, you know, in particular, you know, or certain types of psoriatic arthritis can be simply a result of mold toxicity. So, and I remember just recently I had a young woman, a patient that came to my clinic with musculoskeletal problems, and I sent her to have, I couldn't quite pinpoint, you know, so the reason for her numbness, paresthesia, so I sent her to have, of course, MRI scans, you know, so, and unfortunately, you know, so she was late 20s, beautiful, young bride, just got engaged. We found out that she has multiple sclerosis with multiple plaques, you know, so in her brain and her cervical cord. So, and that's what was causing her symptoms, not the musculoskeletal, of course. Yeah. So, but the first, of course, question, thanks to you again, and what I learned from you. So I asked her, you know, if there was, I mean, when did she start having the symptoms, which was 5 months of seeing me. So, and I specifically asked her, you know, so do you know if there was any chance that you might be exposed to mold? And sure enough, she said that started exactly after my fiance and myself moved into a new apartment. And the first thing she said that I noticed is that we had this black moldy chandeliers in our curtains, so that they were part of the building, So, and of course, she said that I didn't pay attention and I did nothing basically. So, and yeah, I mean, the long story short, I sent her to you and your way. So I hope that she end up in your hands and will get appropriate treatment. So, but yeah, so thank you so much, Dr. Campbell, for your incredible knowledge. Yeah, so and for educating people, helping all of us to really look outside of the box, and definitely curing people. So with the sometimes really devastating disorders, with such seemingly simple treatment. So yeah, really
Thank you so much. Thank you for having me. I appreciate it. It's been an honor knowing you and being on your podcast. Thank you so much.
Thank you. And we will list, of course, your website. So we will list the lab that I know you like. I'll send it to for the
Share with you my screen.
Yeah. So maybe even easier. So we also will have it. So MyMycolab.com. So I know that you are an advisor for them. So yeah, that's fantastic. And
then, of course, here's the lab.
MyMycolab.com. That's fantastic. Yeah. Well, thanks again. And maybe at some point I will invite you back if you're open to that. So to continue the discussion. So because I'm also interested a little bit more in gut health, and I know you have a whole series of topics on specific foods and specific ways to help people to improve their gut health, etc. So in relation or not related to mycotoxins. So yeah, I would feel privileged if you would enlighten us on that topic as well at some point.
Thank you again.
Thank you. And thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. Cures, Remedies, and Beyond podcast with Dr. Irina is bringing together the science of medicine and the art of healing for ultimate vitality and health.